Well, welcome to this 17th session of TAI Institute. Last week we had a wonderful session on conflict resolution and negotiation. Today we meet here for a very interesting topic picked up by John Soloninka, partly responsible for a large number of registrations. We have a wonderful panel of 5 experts here: John Soloninka, Ben Matthews, Bobby Dhanjal, Pat Blanchard, and we're waiting for Nima Lagde. Before we begin, please allow me to thank HTX for sponsoring this session through good offices of John. A word about HTX: from invention to innovation to international innovation, HTX supports emerging and established Ontario-based companies to develop, use, and commercialize innovative marketing-led advanced health technologies. HTX is funded by the Government of Ontario through the Ministry of Economic Development and Innovation. HTX is a member of Ontario Network of Excellence. A big hand for HTX. Before I invite John to take the podium, I would request our venue host to come up here and introduce Alan West and welcome all of you out here.
So I just quickly wanted to introduce one of the partners here at Gowling's Toronto office, Mr. Alan West, who practices in the areas related to pharmaceuticals and healthcare. And he's also a medical doctor, a member of the College of Physicians and Surgeons of Ontario, as well as he's licensed with the Medical Council of Canada and the Board of Medical Examiners of the state of Arizona. Alan's practice focuses on the regulation of, amongst other things, medical devices and the development of drugs and devices. Alan represents and continues to represent many well-known national and international pharmaceutical, biological, medical device, consumer products, and other manufacturers in regulatory and litigious matters across the country, as well as startup biotech ventures. Alan also co-authors a text and contributes to international legal guides. And without further more, I'll hand it over to Alan.
Thanks. Thank you very much. And all I want to do is draw to your attention the fact that on the commercial side of things, for us, I mean small c commercial, you're dealing with a very interesting topic, one that's exceedingly topical, something that's really very much part of today and the future, and these are mobile apps related to healthcare. It's fair to say that it's all the rage, and that it's a very fertile area for development. But there are things to be aware of on the legal side that you want to keep in mind and get proper advice concerning. That is end user agreements and privacy laws, and that's not only in Canada but in the US. You have to also be aware of the fact that if your device or your application for a mobile device is going to involve the participation of a healthcare professional, that is a doctor, a pharmacist, you may inadvertently get that healthcare professional in a, as the English say, a spot of bother with his or her professional regulators, because there are very stringent rules in Canada about how doctors, nurses, dentists, pharmacists can participate, how they can advertise, how they can promote their own practices, how they can steer or whether they can steer patients to suppliers of medical goods, services, or advice in return for some consideration to them. So I have many of my clients who have the best of intentions and have a useful device or a useful idea, but can inadvertently get a professional, a healthcare professional, in trouble with his or her regulator. So you have to keep that in mind. Also, not on the slide, but equally important, for applications remember, especially in the US, often the FDA will take the position that the application itself is a medical device. In Canada, we're, I think, a little more reasonable, and Health Canada has a policy document on the difference between what they call, what they regard to be a medical device and what they call middleware. That is software that interfaces between a medical device or some other medically involved aspect of the delivery of a service to a patient and a device. Devices have to be licensed by Health Canada. Middleware does not have to be. And really, there are also rules on the limits that a medical device maker can sponsor or participate in the development of such apps. So to the extent that you want to partner with an entity that is a natural fit for your application, you should inform yourself ahead of time as to what they can and cannot do by way of cooperating with you. And then there are rules about advertising, and this includes, even if you don't involve a drug company or a medical device company, you just have an application, there are rules in Canada about advertising anything that treats or is meant to assist in the treatment, prevention, or amelioration of specific medical conditions. Again, a potential trap for the unwary. All of which is to say, welcome, and the traditional things you'll be interested in can also be provided for here in a one-stop shopping center called Gowans, copyright, patents, all the intellectual property needs that you may have. And without further ado, I'd like to thank you very much for attending tonight. We're very pleased that Gowans could provide the venue, and enjoy the evening. I'm sure it's going to be very informative. Thank you.
Thank you, Alan. Thank you for bringing this regulatory perspective and plugging for allowing the venue sponsor today. I now invite John Solominka, CEO of HTX, board member Ty, to begin the session.
Thank you very much, and thank you, Alan, for that those opening remarks. I had not anticipated those, but they're actually very, very relevant, and a good admonition to all those in the audience. In fact, it's a good segue to why I suggested this topic for this evening. HTX, we're an early stage medtech investment company. We've got 25 companies in our portfolio, and we do medical devices, medical imaging, diagnostics, genomics, etc. But also we do health IT and mobile apps and things of that nature, or at least we could. We are open to it. But why did I suggest this? Typically, those of you who are familiar with the field, if you're looking at drugs, pharmaceuticals, you're looking at a decade and $100 million to $1 billion to get a drug to market. If you're looking at medical devices, which we typically play in, you're looking at $20 to $70 million to get a product ultimately to market. You've got a lot, as Alan was saying, if you're dealing with, you have to prove your device is safe and effective, you have to deal with healthcare technology assessment, health economics, and so on, regulatory review. It's very expensive, it's very complex, and you need a lot of expertise in your company before you even bother starting to think about developing it. So I was trying to think of, given the audience that Ty represents, and given that a lot of people come from mobile, they come from IT, they come from consumer, they come from a lot of different areas, I was thinking, what would be of most interest? And one thing that's happening, one thing that's disrupting the healthcare system from the bottom up is mobile health. And in fact, engaging the consumer, the end user consumer in North America, in becoming more actively engaged in their own healthcare. But if you look elsewhere, in fact, I was just talking with one of the gentlemen here tonight, if you look elsewhere in the world, where mobile is everywhere and desktop computing is really secondary, then the electronic health records and other things are actually being developed on mobile. So the markets globally are very, very different, and mobile health is very significant. So what we wanted to do tonight was, number one, I've asked Ben Matthews, who is our guy who focuses on mobile health, and many other things, but mobile health is the thing that he is watching. And I've asked him to do an overview of mobile health, give you some framework, give you an opportunity to sort of start your creative juices flowing and say, where might you look for applications? What should you go towards? What should you stay away from? And why? Then we're extremely pleased to have three very busy folks to come and donate their time tonight, and I want to thank them very, very much. One is Bobby Danjal from Extreme, and they are a mobile app developer. They've developed a glucose, a hospital integration on glass, and work with TELUS, all apps and app development, and he'll tell you more about that. Century Tech, which is one of the portfolio companies of ourselves, who has developed an outstanding business integration tool that intimately uses mobile apps in a health IT environment in home care. And Nima, sorry, I can't read it, Gandade, from Venio, who has developed a wellness app. So we've got very different environments, from inside the hospital to in the consumer's hands to in the home care provider's hands, as well as an overview. So I hope this will give you a good framework for thinking about mobile health. But then at the end of the day, also, ourselves, myself, we're here for a panel discussion. If you have questions about the apps that you're thinking of developing or things about what we presented, then by all means, open for questions. So let's start off with Ben Matthews giving an overview of mobile health.
Great, thanks for that introduction. So, mHealth. Basically, going to give you an overview, talk about, from 1 billion this past year to, depending on which variety of report you read, anywhere from 18 to 25 billion by 2018, which is pretty astounding growth. So there's lots of hype. There's also lots of promise around mHealth. And I think it behooves you to understand, there are difficult realities of healthcare when you're looking at mHealth. But there's also some significant opportunities that are actually tied to those realities. So when you look at, if you take the health side of mHealth, generally you can look at healthcare IT. It's complex, it's expensive, it's slow-moving, it's risk-averse, and those are very much conditions that have borne out of the environment in which healthcare IT has been implemented. When you look at mobile apps, generally simple, relatively inexpensive, rapid development adoption, and a significant amount of risk is taken. So I think it's, people look at the mobile side and the healthcare side, and they think, we'll just put them together, mobile will solve all the problems of healthcare, and all the problems will go away. And that's not true. Now that being said, there are some aspects of mobile that are really attractive to healthcare. So if you look at this graph, now what I've done is 124 million. That represents the amount of money it takes to get a biotech drug just to phase 2. So that's to get it to the point where someone might be interested in partnering or buying your drug. There's still another 500 to 700 million to actually get it to market. 15 million is approximately what it takes to get a med tech device to market. Probably another 20 to 30 on top of that for marketing, development, partnering. But what's attractive on the IT side is you can get an app or a product to market for a magnitude amount lower than medtech or biotech, and that's, I think, one of the attractive features of mobile health. And this is important because in Ontario last year, we spent $47 billion on healthcare. So anything we can implement to reduce that amount is looked at with excitement. And this is extremely important because that $47 billion, with 43% of Ontario's budget was actually spent towards healthcare. That's increasing more than anything else in the budget. So that's going to start to squeeze out other social services, including teachers. When you look at those healthcare costs, demographics do play a part. We're going to have this increased amount of seniors. You can see the incredible amount of growth over the next 25 years in 60 to 89. Now, even though people look and they go, that's a problem, I think when you look at mobile health, that's also an opportunity. Can we provide mobile home care? Keep them at the home and deliver the care that they need. Again, you look at the end of life, the majority of healthcare costs are significant. But again, I think that's an opportunity where mobile health can play a part. whether you're providing palliative home care, as Pat will discuss later on, or other opportunities that we haven't thought of yet. I think one of the most interesting things, though, and that I think not a lot of people think about this, but 5% of the population accounts for 50% of our healthcare costs, which is astounding. And the majority of those high spenders are actually younger than 65. There are sort of the diseases of middle age, cardiovascular disease, diabetes, neurological disorders, as well as respiratory disease like asthma. And so, as we talked before about, we have all these extremely expensive drugs that we're developing, all these extremely expensive medical devices that we're developing, and we put those towards that 5%. But even though we have all these great tools that we've developed over the past 40, 50 years, every single one of these only improve care once that patient is already in the system. It's not stopping the funnel at the top, it's just improving them once they're already in. And I think one of the promises of health, once you can get past the hype and look at the realities, is what can that do to address those people before they even get into the system. So the potential, is to deliver care remotely and reduce the burden and cost of infrastructure, transmit that data remotely, that's both to the patient as well as from the patient to the provider, or in many cases, in between providers or insurers, whoever you have, it reduces a lot of the friction within the system. And healthcare has a huge administrative cost associated with it. And the other thing that I think is neat, is that as we've used the computer in our pocket for other industries, we can now apply that to healthcare. And you'll see how this is being utilized by even medical device manufacturers. So currently, the system is, you're at home, you're sick, you go to the doctor, you deliver them the information, they take that information, they assess what you need, they may give you a drug to send you back home, or they may send you further on into the healthcare system. And I think everyone's been through that stage. The future is where we can deliver a lot of this data, wirelessly. You don't have to go to the doctor. You can send your data to them, and you get, some sort of feedback back. Or, there may be an intermediary with a nurse, or potentially even, someone within the family or a specialized healthcare worker. It opens up an incredible amount of opportunity. And I think if you look at this diagram, you could take us back 10 years and replace everything there with banking, and there's a very similar structure. So healthcare is very much behind, a lot of other industries, but it will be affected by the same transforming power of mobile. But I think, there are considerations to get there. But it allows patients to better manage themselves, doctors can better manage patients, and then overall, systems can better manage costs, which every single system, whether it's local, provincial, federal, they all want to do that. And everyone's seen the interest. Over the past 2 years, it's basically gone, the mobile health app market has basically gone from 0 3 years ago to 1.3 billion last year. It's an astounding growth. As we said off the top, that could be 18 to 25 in 5 years, which is absolutely incredible. On the other side, investors have also seen this, and they're very interested. We've seen 1.4 billion last year invested into digital health companies. Over 130 companies received more than $2 million in 2012, which is pretty incredible. And some of the things they are doing, it's astounding, that what they're doing, and also some of the interesting things that they're doing. Some of the things are things that we all wish we would have, and there's also a lot of things that we never even thought was possible. What you're also seeing is this growth of incubators. Rock Health out of San Francisco is one of the leading incubators. Blueprint Health is out of Chicago and New York. And just 2 weeks ago, GE partnered with Startup Health to start a 3-year incubator program down in the States as well. And these are really interesting because what they're doing is they're leveraging the knowledge of healthcare professionals and putting them together with mobile developers who have ideas, whether on both sides, and trying to identify opportunities within the mobile healthcare space. Rock Health actually had an interesting stat that out of all the startups in their portfolio, 85% of the founders were not actually from healthcare. So I think that's really interesting. There's a lot of opportunity for people to enter into this space who traditionally are associated with healthcare. There are reasons for investment. A lot of these are quite obvious. We we spent 126 billion last year in Canada. The US was 2.8 trillion. I say lucrative, generally healthcare is associated with high margins. You see that a little bit in mobile healthcare apps, where there's a high per app purchase number, one of the highest when you look across all sectors in the mobile app space. And traditionally, healthcare actually has been a very good space for VC. So I think they're looking at this as sort of a natural extension with mobile health. And I think one of the most interesting things, as I said before, there's lots of opportunity. And that whether that's business innovation in applying interesting services, or technical innovation that's applying new and innovative products for the mobile space. But, and this was raised before, healthcare is highly regulated. So there's important considerations regarding around privacy. What's the stewardship of that patient data? Who's holding that patient data? Where are you delivering that patient data to? So I think it's not quite the free and easy world comparably that you'll see in mobile. There's a lot more stewardship around how you hold, protect, and deliver that information. Of course, safety, Health Canada, and the FDA. Is your product, is your app safe for use? And of course, what that consumer, that purchaser is going to want to know, is it effective? You have to back those claims up. I just want to go into a little bit to talk about what is regulated, because this is generally from the US side, where there's a lot more regulation. This is a much bigger market, but they have a lot more regulation. So it's basically if your app displays, stores, or transmits any medical device data, and whether that's from a device attached to it or some other device, that actually turns your phone into a medical device. I think an interesting way to think of it is the phone now replaces the computational power that used to be in medical devices. So now, since it's doing that for you, it also has to, you have to make sure that you have the appropriate controls around that. What we see now is that there's also a lot of additional, by using a connected medical device, with the AliveCore, that does an automatic ECG, I'll talk about that later. And as well, one of the big things that's driving is clinical images for diagnosis, where radiologists or other clinicians want to be able to look at the image from a patient remotely. And just another brief overview, what are the general requirements for regulation? You have to register with that agency. You have to label, tell them what it's used for, who's manufacturing, or in this case for apps, who's developing it. You have to establish a quality control system. You just can't, if there's bugs in your code, you have to have a system that allows you, because the problem later on, to come back and identify. Adverse event reporting as well, whether there's a comparable device on the market, because that can affect whether or not, what sort of application you need to get your app approved. If anybody's really interested in reading regulations, I put a short URL there that connects directly to the very long, very complex. I recommend getting a lawyer. So what we've thought of with mobile health is trying to think of a framework for thinking about the different types of companies in the space. I'm not saying this is the way everybody should think about it, but it's helped us internally think about the different ways to differentiate and compare some of the aspects of mobile health. And so we've looked at companies, low regulation and high regulation. And high regulation views either regulation with that device or regulation with regards to patient privacy. And connectedness, none is not no connectedness, that's more cellular connection. Social, I think that's obvious. And to data, that's more to sort of these repositories of data associated with EMRs and EHRs. So took a whole bunch of companies that I'm familiar with, that we're familiar with, and sort of plotted them on there, and sort of gives you a very broad spectrum of the companies that are involved in health. And I think as you go, as you go up and to the right, increased regulation, and definitely as you go up and to the right, increased cost for development of that app. A lot more things in the top right are going to be venture back. So that first quadrant up in the top left, you can generally refer to these apps as medical devices. It's generally dependent on some hardware. AliveCore, as I said before, they have a scanner that attaches to the phone that you put your thumbs on and gives you an ECG. Both Gluco and Band are attached One directly, the other Bluetooth through glucometer, allows the patient to identify their insulin levels. And as I said before, the smartphone replaces the display and calculation computation requirements of the device and actually adds that transmission and other capabilities. And that's really interesting from a medical device development aspect because it allows those new developers to lever that smartphone platform to lower development costs. So I think that's a really interesting transfer of power, even within the existing medical device world. The second way we look at it, and so the middle at the top, regulated but socially connected, are basically services and apps that allow you to exchange knowledge and or clinical information. And I think this space is the one that will allow either companies or other institutions to manage that 5% that's causing 50% of the cost. It allows patient-to-patient interaction with patient communities. Inquisit Health is a mental health connection between similar patients. Patient-to-provider allows provider search. HealthTap and Athena Health allow patients to search out and identify either telemedicine through doctors or identify local services that their patient will pay for. As well as provider to provider, we actually have a sensory tech in there, and Converse Point. And what they do is they allow connection between healthcare providers themselves, whether that's clinician to clinician, or whether that's nurse to nurse or clinician to nurse. And I think those are some interesting aspects as well. Up on the very right, so this is the extremely highly regulated and connected EMR data. A lot of these are going to be hospital clients tying into the hospital. But a lot of the focus here has been involved in taking the data out of the hospital. In recent surveys, 75% of physicians within the hospital have actually accessed patient data remotely. And this is also, you've seen recently a big BYOD trend, as in the consumer world with mobile, where these systems now have to be able to deliver that data remotely to whether it's an Android phone, BlackBerry, or iPhone. And I think the really interesting thing is there's a capacity to transform here as well, because now with this capacity to deliver data both into the hospital and out of the hospital, you can get new services. So Real-Time Medical, down the bottom right, is actually a company here in Toronto, and what they do is they have a cloud service that allows, say, an X-ray imaging facility to put their radiology images up into their cloud. And what they have is a radiology matchmaking service that ties into any one of 80 to 85 radiologists all around Ontario. So that allows them to get a 5 to 6 times improvement in the time it takes to get a read, as well as they've allowed some smaller groups that previously couldn't afford a radiologist to have radiology reads at an improved rate. And this, so at the bottom, low regulation, but cellular and social connection. I think this is a really interesting space that's getting a lot of interest, especially after CES. And these are apps that are hardware-based, but they improve wellness. They allow you to access, information about your fitness, about your own healthcare status. They are generally hardware, software oriented, so they can leverage that capability of the smartphone. Whether it's using the accelerometer, using the camera, or using the GPS to identify where you are. I actually didn't know until 2 days ago that my phone has a barometer in it. So I don't know whether there's some aspect that can be done with some respiratory condition, but I think that's very interesting. And one of the big pushes around this sector, healthcare and fitness, is quantified self. And I don't know whether Carlos is here, but Carlos Rizzo is the local Toronto head of quantified self. And it's a really interesting group where what they're doing is it's all about analyzing, determining, almost like citizen, not almost, it is citizen science, trying to see how they can use apps that are produced like this to better understand people's care and their own, and delivering care to themselves. And this, so the bottom left corner, which is low regulation and cellular and or social connection, I think this is the most interesting quadrant and definitely the most applicable to new entrepreneurs. Because of these low barriers to entry, there's a lot of capacity for innovation. You're not going to be constrained by a lot of regulation. There will be regulation, but it allows for development of completely new ways of delivering healthcare services. Or, you can take existing models and bring them into healthcare. I think we're going to see a lot more of that in the future as well. Castlight Health, that uses the GPS to identify, local services down the states for, what's the best service for you to be utilizing, or what's the cheapest provider nearby if you have a health condition. My Voice is a really interesting technology that was developed here in Toronto by a guy called Alex Levy. Historically, if you had speech pathology, you had to use a large device with about 40 to 50 buttons that had this giant vocabulary attached to it. And what he did is he took a smartphone app, and what it allows you to do is gives you contextual information using the GPS to where you are. So if you go to a movie theater, it's only going to pull up stuff like tickets, popcorn, soft drinks. And it's built right into the app. So it's gone from a $2,000 device to a $99 app for people who have difficulties in making the voice heard. Clinical Connects, I think, is another interesting aspect. That's another Ontario company. And what they do is it's just with the simple technology of SMS. And what they attach into the the doctor's scheduling system, and send you an SMS to remind you of when your next appointment is. If that doctor's running late for the day, it'll send you a message to say you can come in 10 minutes, 30 minutes later. So it seems simple, and it seems obvious, but these don't exist. And these are the things I think that are really, really interesting within the mobile health space. Another example is Text for Baby. This is a great technology running down the States, but it's also comparable in that this is also being delivered in Bangladesh, some countries in Africa, where an SMS, so a healthcare worker may visit or be visited by an expecting mother, and they sign them up for the service, and that mother will get SMSs regarding nutrition and care of the infant once it's born. So they get timely knowledge distribution without further involvement by the healthcare worker. So it can reduce money by the provider and to the patient. And even though Text for Baby is run by a public health organization, I think when you look at the potential business models, this one could easily be flipped to a for-profit model. I mean, Procter & Gamble might be interested in something like this, or develop something like this, where they can identify those people who are going to have babies and are going to be buying diapers, so they can deliver this as a free service to their potential customers. And I think one important note from the healthcare side for us, in all aspects, I think, of mobile healthcare, and this goes true for healthcare IT, I think you have to think of the patient, who benefits, the payer, who's paying for this, and the provider who's delivering this. And it may be a little hard to hold this in your head for a second, but you have to make all three of those not unhappy. Which means that you can't have something that's fantastic for the patient, fantastic for the payer, but if it takes that provider, that doctor, that nurse twice as long and 3 times as long, they're not interested. There's a lot of slow uptake, on EMRs. As soon as doctors started getting, because it took long for them, once they started getting that cash, that sort of alleviated some of that pain. So I think, and the interesting thing about mHealth is in some cases, you could be all three. I may have an app that generates information. I look at that and I deliver care to myself. And for that, I may be willing to pay $2 to $5. So I think there's a lot of interesting things, but I think it's a very good framework that we use to look at healthcare IT in terms of business models. You want to have all three of those not unhappy. And I think a lot of mobile people are just sort of putting it on top and sort of making things better, faster, cheaper. That's great. But I think the most interesting things that will happen is when people find a different way to do things. Change who that provider is. It's no longer delivered by a specialist. It may be delivered by a GP. Change who's paying for it. It's no longer paid for by the system, but for this company that wants access to some of the usage data. And I think those are the things that are really going to have impact in the mobile health space. And this is disruptive innovation. I'm sure some of you know quite a lot about Clay Christensen, but he's written some pretty fantastic books about innovation, and one of them is focused on healthcare. And I think BAM app is a great example of this. The patient, they get iTunes rewards for increasing their use of the glucometer. They get social reinforcement by this being published to either Twitter or their Facebook feeds. The doctor likes it because it's better patient care, and the payer in this case is actually the strip manufacturer for the glucometer. As they increase their compliance, they're going to increase their consumption of those strips. So they're happy to support the BAN app in that it provides more revenue for them. So I think there's a lot of different business models that have opportunity. And so what does this mean for you? There's lots of opportunities. And I would recommend, look for a market need. Don't try and stuff a great technology into some space that may not be relevant. Look at other industries. How are they using mobile? Can it be applied to healthcare? And I don't know if anybody knows the Steve Martin quote, but do one thing really well that people can't ignore. If you want to know more, some great resources out there. Mobile Health News, Rock Health. Eric Topol is a physician down in the U.S. who's really pushing and supporting mHealth, and he puts out a lot of great information. There's a great digital health group run by this guy called Paul Sandier. The people up here at this table, we'd like to talk to you as well. Or if you want to get involved, there's things like Hacking Health, Quantified Self, and a lot of local companies. Thank you.